I've thought back over dozens of intubations I've done, and every single one, I'm always just like I'm sometimes the last person, like whoever ever will speak to this person, while they're still alive and not on a ventilator. That's the hardest part, I think, is that moment where the patient's scared and you're potentially the last one to talk to them.
I do remember very clearly, actually. It was a Hispanic woman, and watched her over the course of the few days, and I just saw each day she progressively got worse. It was the things that we're now used to. And then we had to talk about being placed on the ventilator to help with her work of breathing. And, she was very scared. And the time came for intubation, and, the team gathered, and I could just, I looked at her and I just watched her while she lied in the bed with the mask on. And she was just looking up to the ceiling. And I came in and I was talking to her, and I just took her hand and she said, "I'm scared." And she asked me, "Am I going to die?" And I didn't know what to really say to that, honestly. She squeezed my hand even harder and she said, "But I'm scared." And, I just repeated the same thing, over and over, and said that we'll take care of you, and I promise that we'll do the best that we can, because I couldn't say anything other. I didn't want to give any false hope, just to say, that you'll be okay, because I knew that she probably would not be okay.
It's a huge weight, thinking back over the past year of, that responsibility, and, what do you tell them? We know, a lot of patients don't do well, some do, but you never know. And kind of what do you say in those moments? And I still don't know if I say the right thing.
You can't promise that they'll be okay, that they'll see another day, but
yeah, it's that moment's tough.